I'm Dr. Benjamin Dowd-Arrow, medical sociologist and expert on all things related to guns in America, and this is the third episode of Trigger Warnings and My Loaded Thoughts. A 13-year-old was just arrested in Washington State for threatening to commit mass shootings. At the time of his arrest, they found 23 firearms, secured and unsecured, in his home. Some of them have been mass printed, some of them did not have serial numbers on them, and they found materials that suggested he idolized those who committed these acts, as well as planning one himself, although they do not know who he was planning his attack against. And as of the publication of this video, the parents have not been charged nor arrested for any crime. However, we're going to come back to that. Now, despite what politicians might tell you, there's actually a lot of overlap in how Americans feel about mass shootings and what we should do about them. And when we look at the views of Americans, we can see that the top three things that Americans think cause these events are mental illness, access to guns, and hate and bias. Now, where we see differences is among party lines, where Democrats believe that the number one cause is access to firearms, and Republicans believe it's mental illness. Let's talk about both of these. Now, let's be honest here. I don't think any of us would make the argument that a person committing these events is mentally stable. I think we would all agree that mental illness does play a part. However, when we look at the facts of the matter, only about 25%, according to the FBI, had a diagnosis at the time of these events, and most of those diagnoses were things like anxiety or depression, not the psychotic disorder that might lead someone to becoming violent. They had disorders that were more likely to make them victims of crime. And that leads me to the other part of this. Mental illness is often used as a scapegoat to prevent people, from exercising their autonomy in public. And so we criticize and stigmatize people with depression and anxiety. And when we say that they're also mass shooters, we're further doing that to American citizens. Men in particular are underrepresented in mental health patients because of stigma. They are told that mental health is weakness, and so they do not seek out services that they may need. And so when we start saying, mass shooters have mental illness, now when we just think about it from an economic standpoint, Americans underutilize mental health resources because they're expensive, insurance doesn't cover it, and it takes a lot of time out. Now let's add stigma to that mix. Men may be even less likely to seek out services that they need, especially when they hear that the most commonly diagnosed mental health issues are anxiety, depression, which is what most of the people were diagnosed with before they committed these acts. The other issue with labeling it a mental health issue is that it creates what I call a minority effect based on the movie with Tom Cruise, where it assumes that psychiatrists and psychologists can predict which people they see are going to commit these acts. Now, this minority effect puts the onus of keeping us safe not on the government, but on therapists and doctors who should be able to predict the dangerous people in our society. And this leads to a problem when it comes to the lone wolf narrative. Because if these events are perpetrated by a lone deranged wolf who is mentally ill and psychiatrists, psychologists, doctors, etc. can't find out who the dangerous ones are, then what is the purpose of laws? We shouldn't have laws at all under this theory. And that's a narrative that politicians tend to go down. It's like, why should we pass laws? We should just give more guns to the sane people without actually treating it. And politicians don't really want to do anything about mental illness to begin with. Because across the board, Republicans continuously cut funding for mental health services. Donald Trump just cut $11 billion in funding for addiction and mental health care. And that's a political trend that goes all the way back to this guy, who ended state funding for mental health services while he was governor of California, and then did it nationally when he won the election in 1980. Besides, we do know that access to guns plays a significant portion to these events because states with stricter laws have lower gun mortality, and that includes mass shootings, homicides, suicides, and accidental gun deaths. It is a well-established fact, going back at least 25 years, that more guns equals more crime. And as an example, things like red flag laws, safe gun storage, and universal background checks would have eliminated numerous events in the last 10 years. And this leads us back to the case from the beginning where the 13-year-old was planning one of these events. In this case, I think that the parents should be charged with something because the guns were unsecured and they were not monitoring what the child was doing. At 13, the parents are responsible. I would also say that at 13 in the state of Washington, you cannot legally buy a firearm. A parent has to buy it for you. So in this case, the parents should absolutely be charged. And that does it for another episode. Let me know your thoughts and comments, any questions, and I'll see you next time.